everyone. How are you?
Hey.
We're
Hi,
gonna
everybody.
Hi. We're gonna get started in a little bit. We'll wait maybe one more minute before we get started.
Hello, everyone.
Hi, Jamie. So happy everyone could join us on a beautiful Thursday. Is it Wednesday? It's Wednesday.
It's Wednesday.
Okay, so we're gonna go ahead and get started. Before we get started, if everyone could put themselves on mute. If there are any questions or comments that you have throughout the presentation, please feel free to drop that in the chat. And there will certainly be time towards the end of the presentation to talk. So to get started, thank you all so much for joining our kickoff campaign. We're really excited to share our health needs navigation campaign. This is the first time we're launching this campaign, and this is certainly going to be a strong staple. This is going to be a campaign that we continue throughout the year, an initiative that will not expire. So while this campaign will exist throughout the month of October, this is something that will continue to be ongoing. And so just to take care of some housekeeping, so I'm going to ask if everyone can mute their lines again, enter any questions or comments that you have in the chat. And if you are willing and able, there's no pressure, but if you would like to turn your camera on, we would love to see all of your faces. And we also want to make sure that we thank our sponsors for making this campaign possible, this campaign and the money that we have throughout the year. And just high level, going over some key objectives for the call. We're going to go over the background and the goal for the campaign. So what exactly is needs navigation, the different actions that you're able to take for the campaign throughout the month, what your influence and impact will look like throughout the month and in many years to come. I'll also be going over the toolkit for you all, so you guys can see sort of more specific actions that you're able to take. And of course, we want to hear from you towards the end. So I'm going to go ahead and pass it off to Rebecca to get us started and discuss a little bit more about the Health Needs Navigation campaign.
Welcome, welcome, welcome. We could not be more thrilled or excited this week and next and beyond. As Mary said, this is an enduring campaign that's been a long time in coming, but really ripe for opportunity, because we all know as advocates at Patient Advocate Foundation that health does need navigation. And though the name says quite a bit, we wanted to give a little bit more context to welcome those of you who may be new to the organization, and certainly warm welcome back to those who are ardent advocates already. Health needs navigation is at the very heart and soul of, I think, all of us and our shared objectives as volunteers, as advocates, as ambassadors of person-centered care. So we welcome you all. We're thrilled to dive in, and Melissa is kind enough to help move the slides forward, or maybe it's Mary. I can't remember which of you, but please, thank you. We often start off with the context. What is our denominator of people that we are trying to help? And here it's huge, because financial distress, as many of you know, and all of you can appreciate in one form or another, financial distress is a reality for many patients and families in the context of their complex chronic conditions. And we put a finer point on that with some Patient Advocate Foundation data, where we surveyed the patients and families served by us through our case management services about their top concerns in facing their disease and the constellation of concerns that means. And overwhelmingly, that green bar at the top is the most people who said what I'm most concerned about is financial burden, the costs of treatment, and I would extend that to say, and everything else on top of it. How do I make ends meet Where do we go to get the help that we need? How do we find a person like what PAF offers? They characterize financial distress as a fate worse than death, to be sure, which is surprising, but is it? What we know is that patients and families don't want to be a burden for their loved ones, and they hold very dear financial viability while they're facing a serious illness, even above symptoms, side effects. Some of the other things that we often see in the literature are top concerns on top of living. In this population of patients and families who are typically underrepresented in research findings, it's sort of a clarion call for what we know we need to do to help address the distress that people have as part of quality care. So next slide. The big opportunity that we have comes from what we've learned from real people everywhere that our organization takes care of, that we interact with, and the stories that all of you have shared in your professional capacity, in your personal capacity, in your caregiving capacity. We have learned these 4 simple truths that sort of become the playbook for this campaign. Financial and social needs, they're typically overlooked, put on the back burner in terms of focus on what care means, even though they're very distressing and help contribute to the health disparities that the country is really talking about now and grappling with. So something that's overlooked, we need to shine a light on to make sure that it sees the light of day, and that opportunities to do good work can happen. We know, and the data I just showed you bears this out, that financial distress is a top concern for many, many patients and their families, and even for health professionals. Everybody needs to know what to do here. And the playbook for quality care has to prioritize communication about these top concerns. Let's not leave them on the back burner, on the back shelf. We need to put front and center the non-medical and medical concerns that patients have, so we can make sure that we're supporting what matters to them as part of their experience with care. And finally, that 4th simple truth is kind of the all-important one in terms of the solution that we're crafting here for all of you to help us explain in your different spheres of influence, that navigation services focused on social and financial concerns, access and affordability, those challenges, we need to make sure that navigation services are available, because it's really nothing short of a lifeline for patients and their families to getting better outcomes that reduce disparities and help ensure equitable access to high quality and affordable care. Next slide, Melissa. So here's our ultimate objective for this needs navigation agenda, which is person-centered, to be sure, because we're focused on the person beyond the disease. That's what needs navigation is all about, asking people what's concerning them most. Let's see what we can find you. How can we steer you? We want to make sure that this kind of navigation that supports people's entire constellation of concerns becomes part of mainstream medicine. That's a lofty goal. Maybe it's aspirational. We know it's achievable because Patient Advocate Foundation has been doing exactly this for the last 25 years. On a shoestring budget, if you will, considering the demand and the need. It's time to raise the game, bring in other stakeholders and the government to think about the opportunities they have to be part of this solution that has a proven track record, thanks to what Patient Advocate Foundation and others who are working in the space of financial and social needs navigation. And there are many inside our organization and outside it, in cancer centers and community health settings, on their own. We need to make sure that the distressing worries that people have about healthcare and the rest of their lives, that this access and affordability challenge that becomes a quagmire, that needs to get treated too, right alongside people's disease. And we want to support people's financial and social needs as an essential part of quality care. So this is sort of the scaffolding, the context for what we want to see happen, and the backdrop for the campaign that we're focused on now. So if we go to the next slide. this is where we start with our campaign goal for right now and why we're so thrilled that you're all here. We want to build an echo chamber of understanding in every community, in every circle, about exactly what patients and families need in the form of navigation, and why health needs navigation to get people to and through the challenges they face, both medically and non-medically, in terms of their quality of life, their concerns about costs, all the things that we know from the patients and families that Patient Advocate Foundation takes care of every day, and others, and countless others that we never get referred to us because they simply don't know where to go. We want to help all people, every population, know why health needs navigation and how these services help patients and families avoid both the inequities of social determinants of health impact, as well as financial and social distress. So we'll go to the next slide. And this is where I leave off by sharing with you a little bit about the pictograph we've helped develop to describe exactly what needs navigation is and must be for everybody, not just the chosen few who are lucky enough to find navigators or case managers or social workers or community health workers, the swath of people who are out there trying to fill the cracks in a system that has many fractures. The medical system is depicted in the blue box to the far left with diagnosis up top. And there's really a myopic view of what total care means to think just about medicalizing everything. But patients, reflected in the middle box, are thinking about the swirl of other stuff that's happening in their lives. And how will I make this work? These mounting costs, the potential for debt. What will treatment do for me and my workload, my ability to work, my insurance coverage? All those questions are swirling in your head, let alone how am I going to make rent or mortgage, pay for my utilities, make sure there's food on the table, etc. when I've got co-pays, co-insurance, or maybe out-of-pocket bills that aren't even covered. That's the reality that most people who are diagnosed, I don't need to tell this group that, but most people have a very harsh reality that hits them hard when it comes to a complex or chronic illness diagnosis. And that's where needs navigation comes in as a key support layer to help in domains that are outside the context of medical care, but truly critical to making sure that quality care happens. So the domains that we have in this clipboard include the advocacy for financial concerns and financial health, financial care planning, medical billing assistance to make sure that mounting debt doesn't become unbearable. And often there are medical errors that you simply may not know about that navigators can help walk through and resolve. Social needs assistance crosses the gamut of healthcare plus household needs that people have that persist even during a health crisis. Insurance and enrollment advocacy to help people find their way to and through benefits, whether it's insurance, other types of benefits with Social Security, disability, etc. And then workplace services and supports, helping people make sure they take advantage of the benefits that they've got through their employer, understand what paid leave might look like and what their options are. All of these different elements are outside the context of the health system, but directly relevant to what people need to make sure that they have equitable access to high quality care that's affordable for them and avoids the financial distress and devastation that we often see. So that's the backdrop for this campaign that we're particularly thrilled about. And I think the most significant reason for all of us is this is, again, the heart and soul of what Patient Advocate Foundation's core of being is, to help provide the navigation services, the copay relief, and the assistance that people need based on what they tell us. We're putting our money where our mouth is, literally, with our policy agenda now and this campaign. And we are thrilled to have you all here across the gamut, those who are patients, caregivers, advocates. Many of you may be financial navigators or patient navigators already who are involved in this campaign. We welcome everyone to work together, and Melissa's going to share with you, together with Mary, how. So I turn the baton over and thank you.
Thank you so much, Rebecca. As you were talking, I couldn't help but think how you mentioned that this is, just the heart and soul of who we are. And I think it's also the heart and soul of our volunteer program. And this is why we think this is a particularly compelling campaign for you all. And I'll share with you, my excitement for this campaign comes from a very personal place. I learned about Patient Advocate Foundation maybe 10 years ago now. I signed up to volunteer shortly after I learned about it. And I was just really looking for a place, a community, who could really champion these types of issues. I had worked in the healthcare field. I had worked in, doctor's offices, in the emergency room, and there was this whole side to the patient experience that I felt was just missed in the healthcare system. I remember, I worked as a medical assistant as soon as I graduated from college, and I remember having to be on the phone for hours, waiting on the line, trying to get a prior authorization approved for certain patients, or having to explain to patients why, this particular medication was denied and why they had to, take this other, prescription instead. And it was just so confusing for so many of them, on top of whatever it is that they were going through with their diagnosis. And so when I signed up to volunteer for National Patient Advocate Foundation, I was really looking for a place that could champion these issues. And by golly, I found it, because I'm just so excited for us to be launching this campaign now. And I imagine, because of the conversations I've had with many of you, that you all are excited about it too. When Mary and I, when we talk to you and you share what led you to find National Patient Advocate Foundation, what was that moment that said, you know what, I'm going to sign up to volunteer. So many of you share stories about your discontent with our healthcare system, how you had to advocate for your loved one to get the care that they needed. If you weren't there, what would have happened? And that is what just fires a lot of you. And we are so glad to have you in our network. And so really, when we have this slide here, who better to advocate for this than you? It is absolutely true. And we really are applying this, this grassroots approach to getting just to build buzz about needs navigation and why people need to understand, its importance and why it should be embedded in our healthcare system. And so what we want to do with this campaign, or specifically what we want you all to do, is to explain to every audience. This could be your neighbor, your family member, your friend, your coworker, who needs navigation helps, how navigation steps in to help, and what the benefits are when navigation happens. I think there are many examples from the stories I've heard of just that comparison and contrast of, this was my situation and I didn't have needs navigation. But learning about Patient Advocate Foundation and knowing that it's a service and sharing that resource with other people, you see what that impact is. And that is what we want to capture in this campaign. And so part of what we want to do here is build demand for needs navigation. And so how do we do that? How do we do that from, at this, level of campaigning? And the way we do that is we, at a very fundamental level, we raise our concerns about costs, about access, we ask for help, and we let others know that they're not alone. And we have resources to help with how we build that demand. So we have an FAQ that we've created. We have a new Can We Talk resource coming that provides you with that scaffolding to talk about, the concerns that you have with either your doctor or, someone in, your doctor's office or the health system, to say, my out-of-pocket costs are what are, are bothering me right now. I can't afford to go to physical therapy every week because the $60 copay is too much. What are my other options? What are the ways that could help me? And I use that example specifically because I remember my mom telling me about, she was going through physical therapy and she was just like, this, $60 copay is too steep to go for, twice a week. I don't know what to do. And she was just considering not going at all. And I had told her, why don't you ask? And for her, it was just, she just did not even know that she could ask. And I think there's so many of our patients or just patients out there who just don't think that they could ask or talk about that. And we're here to say that, yes, it is okay to raise those concerns and to ask for help. And in terms of letting others know that they're not alone, I talked about that, what led me to find Patient Advocate Foundation, National Patient Advocate Foundation. And you all have a very similar aha moment, that moment of insight where you learned that our healthcare is just complex and confusing and that you want to do something about it. And that's what we want you to share as part of this campaign. And here, excuse the animation here, but I was hoping to make it a good point about how you can carry out these tactics. So you can share that aha moment or share our resources by having just a conversation with someone. You can post it on social media, you can write a letter to the editor, and you connect with local groups. And these are the same things you may have seen if you participated in our other campaigns as actions. And I just wanted to make a particular emphasis here that, yes, these are ways to advocate for needs navigation. And some of you, may be like, well, I'm not so comfortable with social media. I prefer to, just have one-on-one conversations. That is absolutely fine. All of these actions are just ways that you can just share this advocacy for needs navigation. But something I wanted to emphasize here are just two questions that you should ask yourself when it comes to determining, what actions should you take? And these questions are, who do you want to reach and what's your capacity? And in our toolkit, which Mary will talk about and show you in just a little bit, we've identified audiences that we think where this campaign will really resonate. And we've outlined, either just steps and templates for you to follow. But just want to make a finer point that, in who you want to reach, that is just so important in determining what your influence is. So by having a conversation with someone about needs navigation, you're directly helping someone you care about. Know that, it's okay to, raise your concerns. It's okay to ask for help. Sometimes people just need to know that. Connecting with local groups, if that is, where you decide to focus your action, know that that will help reach our target audiences, patients and caregivers, actual needs navigators in your community, or people who traditionally have limited resources. These are all groups who need to know about needs navigation. When you post on social media, sometimes you might think that it's just going into the social media ether, and sometimes that's true, but it may end up just catching someone's eye who has a huge following, and that person might feel validated with what you shared and help amplify that, and that really leads to that echo chamber. And, writing a letter to the editor, it's a very traditional way of expressing your viewpoint, but you're very likely when doing this action to reach someone who is influential. And so I just wanted to just highlight, this is how we make impact. And this is why your particular advocacy is important here, because you all have such incredible lived experiences. And we think that's enough to move the needle on, how we embed eventually needs navigation as part of our healthcare system. So as I indicated, we do have some campaign resources as part of this campaign to help make, help you deliver this message more easily to the people you're connecting with. We have a new needs navigation FAQ, and we have a Can we talk about my cost of care resource coming up. We will likely debut that in the coming weeks, certainly in time for our week of action. But just know that we have designed a lot of steps and templates as part of our toolkit to make your advocacy actions much easier. So at this time, I'm going to turn it over to my teammate, Mary Makira, who will show you exactly how to navigate our toolkit.
Thank you. And Rebecca and Melissa have done a phenomenal job describing top to bottom what this campaign is and how you're best able to use your voice and your time to amplify this campaign. And there are different actions that you can certainly take throughout the month, which Melissa has mentioned. And we're going to, go over the toolkit a little bit high level, just so you're able to see how to navigate there, exactly what tools are available as well. And just some key actions that we definitely want to make sure we are emphasizing here. There are two main actions that we want you all to take part in. One of them is going to be talking to people in your community. So whether that looks like connecting with different groups in your local community, talking to local stakeholders, talking to your neighbor, your sister, your friend, whoever, we want to make sure that we are bringing awareness to needs navigation, and people are aware that there is a gap that exists, and this is the answer to that. The second thing that you're able to do that is very key here would be to share your story. Whether you're a patient, a caregiver, or a provider, we want to make sure that we are getting your perspective to not only bring awareness to the campaign and to needs navigation services, but to really highlight the demand for it. And the only way to do that really and to strengthen that message is going to be to share your story, of course. And so to take a quick look at our campaign calendar for the month of October. So we have our week of action scheduled right after Patient Congress. And I will, at the end of the presentation, drop a link for you all to register for Patient Congress if you have not done so already. But from the 11th to the 15th, on day one on Monday, we ask that you talk with someone whether it's one person, 3 people, 10 people, and really, use our conversation guide to guide you within these conversations about what needs navigation is, how it relates to your specific community. If there's something that is done well or that could use some improvement within your immediate community, we encourage you to have those conversations. The next day on Tuesday, we encourage you all to write a letter to the editor, and we have a guide on that as well within our toolkit. So we're not going to leave you hanging there. And of course, donating your story, and if in whatever form that comes in. If you want to submit a video, you're able to do that. If you would prefer to submit a blog or something fairly short, we are more than happy to amplify your story. And of course, on the 14th of October, that Thursday, we are encouraging you all to recruit a needs navigator to attend our policy consortium in November. And on Friday, of course, post on social media. So as Melissa had mentioned before, at times, it may feel as if, only 3 people are going to see this or interact with this post, but those are 3 individual lives. And if everyone could reach 3 people on this call, that's, my math is terrible, but about 190 or so people that are being reached. So you're not doing this alone. It may feel that way because we're all virtual right now, but you're not alone. We're all doing this together. And every one person that you speak to, it's actually quite a big deal. And on top of that, with social media, you're able to also tag people within your posts. So if you want to tag a local legislator, you want to tag your state senator, somebody on the Senate Finance Committee, whoever makes sense to you, that's a way that you're able to sort of immediately grasp their attention because they will get that notification. And there are people who are staffed in their offices to look out for posts that they are tagged in. So you are making an impact if it is that one person, it's a senator or a neighbor who's able to benefit from that. And on the final week, we have 2 things that we will ask for. So on the 25th, the last Monday of the month, we're going to ask that you submit your different campaign actions that you took. The reason why we ask for this is because so many of you all do such incredible things already in your free time, with NPAF and beyond. And we want to make sure that we're capturing that. We know the power and strength that you all have. And it just really does build a much stronger case for your representatives. So that we're aware of it, we're able to share all of the actions that you're doing with your legislators, and we're able to help other volunteers really see the impact that we're all having together. And everyone can just sort of take ideas from everyone else and what everyone else is doing within their community. And of course, we're going to have our campaign wrap-up call, very call heavy in the month of October, but all good things. And so looking at the campaign toolkit that we have, how you're able to get here is through our website. So if you go to npaf.org, I don't know, Melissa, if you want me to do it on my screen or, okay. So I'm going to go ahead and share my screen really quickly, so you all can know how to navigate to the campaign page. And let me know if you can see it.
Yes, we can see it now.
Let's see now, perfect. So you go to our website, npaf.org. On the right-hand side, you're going to go under the volunteer tab. You're going to select Health Needs Navigation. And this is going to take you to our campaign page. Oh, okay, there we go. It's going to take you to our campaign page. So we have our logo. This will take you to our toolkit. And this campaign page has snippets of what's on the toolkit, as well as additional resources that you're able to take. When you scroll down here, you'll be able to submit your story as well. So if you are submitting a video testimonial, that is kept at 3 minutes. You can be a lot shorter than that as well, if you like. We encourage that. And we give you quick tips on how you're able to really articulate your story. So if you're having some challenges, we have, first identify a challenge that you may have experienced within your position as a patient, caregiver, or provider. And, what health needs navigation problem did you encounter there? And second question, or the second tip, is to identify a choice you made to improve that. So for example, if you received your diagnosis, I thought I had to pay everything out of pocket. And the choice that I made in that moment was to make sure that I could do something about it and make sure that nobody else had to face the decision between paying their rent and having a roof over their head or paying for life-changing medication. And identifying an opportunity within your story to make sure that we are garnering support for health needs navigation. And so what's the opportunity for action that you saw within your experience? Did you begin volunteering within NPAF? Within this volunteerism, you discovered there actually is something that I can do. Some of you I know we've connected with to speak with some of your legislators. And this is something that you're able to share here. Just really quick points that you're able to share at the beginning and continue on with whatever else you feel is important for audiences where you live. And we also want to make sure that the stories are fairly diverse because you all have very unique experiences. And we want to make sure that it accurately represents the people within your state and the people within the community. Because ultimately, you're not only the expert of your experience, but you're the expert of your community. And you're going to know how to communicate this campaign to them. So while we certainly want to provide as much guidance as possible, the reality is you know how to talk to your people. and you know what's going to resonate and you know what's going to stick, and you're able to best identify exactly what the gaps are and how this really does help cure it. And of course, we are here to help support you in your advocacy. So if you need to spend some time with me over the phone, or Melissa over the phone, we're more than happy to connect with you and configure that message. And when you scroll further, we give you some sample scripts here. Just type in your name, your email, and you can start recording or upload an already existing file that you have, video file. And then if you have a script that you would just like to type in here, you're able to do that as well. So just scroll up here. We're going to go over our campaign toolkit, which will take you to our Google Doc. And it gives you a little bit of background on the campaign. And we encourage you to share this as well for other people who may be interested in joining the campaign. And Rebecca did a great job describing what this campaign is. So I won't regurgitate a lot of that information, but it starts off with the background, who our target audiences are, which of course is everyone, but to be a little bit more strategic here, it's going to be patients and caregivers, populations who are traditionally limited resourced, and needs navigators in your community. We also have different actions that you're able to take. So this is just sort of quick actions that you can take within a minute or two, would be to sign up for our campaign digest if you have not done so already. And our campaign digest will come out once a week in October. And it's going to give you quick actions you're able to take that day or that week. Give you updates on what other volunteers have been doing. And of course, we're going to be sharing some stories as well. Attending our patient congress, which is coming up next week from Wednesday to Friday. Participate in our dedicated week of action. And of course, follow us on social media and recruit fellow advocates as well to partake in this. We have our calendar with actions you're able to take during the week of action. We have our campaign talking points as well. So if you're a bit stumped or you don't know exactly how to message certain things, you can take this and tweak it and make it make sense to the people that you're communicating with. We also have some sample social media posts that you're able to copy paste into your social media, whether it's on Twitter, Facebook, or Instagram. And the third week of October, we are going to have a Twitter chat as well. And we have a guide here as well where that you can click through and see all the questions we're going to have ahead of time the Monday prior. Of course, donating your story. We have some guidance here on that, but a majority of the details will be on our webpage. Writing a letter to the editor, as Melissa had mentioned before. So this gives you a little bit more information about the value of writing a letter to the editor, the best way to sort of message what your goal is and what you're trying to say. Also, I didn't realize this may be really small for you. We also give you a sample letter to the editor as well that you're able to just sort of look at and just tweak to your liking. But we have some raw talking points here that we may be best, so you're not too influenced by this. And of course, identifying stakeholders that I believe Melissa had mentioned before, Melissa and Rebecca earlier on in the presentation, just different ways you're able to do that, who stakeholders are in your community, and it's going to be different everywhere. I know where I grew up, the people, if you want to get anything done where I grew up, you talk to people in education because they are well connected. Everyone wants to be on their good graces. So I wouldn't even directly go to the HHS department, go to educators. And it'll be different for everyone. And we have an email template as well. If you're reaching out to whether they're local representatives or friends of yours, colleagues, different groups, universities, hospitals, whoever, we have just a quick little template that you're able to use here. And you can CC me in the email. I'll drop my email in the chat as well, just so we're able to keep track of different things, or you're able to put it in our reporting, where you're able to report your advocacy actions. You can do it every week. You can do it at the end of the month, during the week of action. You can submit as many times as you like. We just want to make sure that we're recording all of your great deeds. So that is the toolkit in a nutshell, and that is how you navigate there. We have 18 minutes, and we are happy to take some questions. And let's yes, we would love to hear from you.
And Mary, I just wanted to call out before we see other questions coming in. If you don't mind sharing your screen again and just using the menu bar or the table of contents to navigate for easy navigation of the toolkit. Just so people don't feel like they have to scroll through the many pages we've outlined.
Yes, you, if you are mostly interested in the campaign calendar, you can just take that and run. If you want to grab some social media posts on the left-hand side, you're able to just sort of click through the different areas from the toolkit that you are most interested in looking at. Or if it's, for me, sometimes maybe it's too many words, so I'll just do Control Find, and then I will type in, social media, and then it'll take me right to where I want to go. So you're able to do that.
Hey, Mary, I have a question, but I didn't see like a raise hand button on my Zoom.
Of course.
But I definitely love this campaign. Like we spoke about before, I'm really excited about it. The thing that I think excites me the most is that the week of action falls during a committee week, and I live in Tallahassee, so I'll be right in the center of everything going on. And so I would love to set something up with either you or Melissa to like kind of go over how I should go about that. Because I definitely want to maybe drop off some flyers at some people's offices, maybe set up a meeting or something. So I'm not sure. But another thing that I did want to say, going way back to when Rebecca was talking, this kind of floated into my head. This week, I noticed that my healthcare premium, this month, my healthcare premium went down by $100. And I called my healthcare insurance company, and they told me that the president had like passed some bill to lower healthcare premiums. So maybe we could use that as like some kind of incentive to get people to register for healthcare, or encourage people to be more optimistic about our healthcare system because they're giving people a break. I'm not sure, but within my own self, I was very excited. I was like, wow, I'm gonna save some money. So, but that's it. Thank you for letting me share. Appreciate it.
Of course, we would love to connect with you. I'm taking notes as well. So if I look like I'm off to the side or something, that's what I'm doing. I'm either typing my notes or writing them down. But yes, we will definitely set up a call and get a little plan of action together and figure out how we could best communicate this campaign to the people in Florida. And I know your $100 less per month premium probably excited Nicole a lot. So, and I love that. I think that's a really great, because this campaign will transition into our Get Covered campaign as well. And so this is just, different. Well, right now it's very specific how we're articulating needs navigation. Offering that type of information is super important. Making sure that we're narrowing the health literacy gap as much as possible. And this is part of it, making sure that people are up to date about what's going on that with premiums that directly impact them. So this is exciting. Congratulations, $100 extra a month.
Thank you.
Hey, Brittany, is that a real premium reduction, or is it just for the 1 month? Because I know that a lot of the insurance companies were required to do premium rebate that they applied to a September premium because they had fewer claims during the last calendar year. Because COVID was paid for by the government, a lot of people didn't go in for healthcare. So just confirm that it's really a premium reduction as opposed to just a rebate for 1 month, because we got that too, but it's really just a rebate that we got for 1 month.
I got you. I really hope it lasts. The agent on the phone didn't tell me a time limit, but I'm hoping that it's a permanent thing. But I will definitely follow up and circle back with the group on that.
I think you're on mute, Mary.
Sorry, Tony K.
Yeah, I was just wondering, if this campaign continues forward, will there be more of an effort to do like more national media or just some type of like public service message, some way of getting out to a more broad audience other than the website?
I can answer that, or Rebecca, unless you want to as well, but the answer is yes, because this is very much a campaign that we are going to be focused on, not just this coming month, but the next coming years, and not just in campaign season. So any effort that we will be doing to address this, to reach a broader audience, as you indicated, Tony, absolutely. So, and again, that's why those capturing your aha moments, to use them in, those, such strategic stories is going to be really helpful as we really galvanize the public around needs navigation. So the answer is yes. Rebecca, I didn't know if you wanted to add more.
A resounding yes, but also, Tony, the strategy here is to build our base of grassroots support to a tipping point where that national message can't be ignored. So you're spot on, and that's in line with the strategy we want, but we're starting with this. My team hears me say often, first we move the marbles, then the mountains, and that's our strategy here with this campaign. We start with all of you and building that grassroots echo chamber of oomph. And then we move to that higher level of, and that's where the reaching out to others in the field and slightly outside the field who don't even know that they're doing this come in, so that we really spread our wings with this message and bring everybody together. And there's some national work that we're doing on top, some of which we'll be hearing about next week at Patient Congress. So this is a really important warm-up band for what's to come at that national scaled level.
Thank you, Rebecca. And Cynthia, I see you have your hand up again.
Yeah, I'm just wondering, so we're just trying to tell people about needs navigation. We're not trying to do anything about it. We're just saying, be aware that it's out there and you should be advocating for it. Or, I mean, I'm not quite clear what the message is, other than to educate people that there is needs navigation that could be available in their neighborhood or their community, or there maybe not there isn't any.
That is exactly right. And you got it just right. And I don't want to diminish just the talking, because that is exactly what this campaign is about, to just start building that buzz. Because from our experience, many people don't know that it's out there. They don't know to ask. Many of them think they have to figure it out for themselves. And so we want to make it a point to say, if you need help, make sure you ask. And, then the other side to that is, the person or the practice or the health system that the patient may be interacting with might not know where to go, or know that, that they even offer health needs navigation. And so the idea here is, the more times people ask, the more the health system should meet those demands that the patients are deservingly needing. So I hope that makes sense.
At the same time, Melissa, is exactly right. We need to build the buzz. Socializing this as a problem with a solution that has health equity at its core. At the same time, we're building the opportunity through outreach that many of you have already been engaged with Senate Finance Committee staff, because those meetings are ongoing, in targeted force and sequentially, to build that steady drumbeat, so that the only audience we're focused on for this campaign is all of you reaching your audience. But that doesn't mean that's the only audiences we're talking to. We're reaching out to different organizational partners to get them to sign on to our statement of principles around the 4 simple truths that I highlighted here up top, that this is an overlooked area of quality care that has health equity at its core and requires concerted action by many. So we're building a posse of stakeholder allies at the same time. And we're building understanding and allies on Capitol Hill. And we hope to do so in state houses as well with your help, where we don't have as much reach as we sit here in Washington, DC. But the opportunity, again, is to reach every audience everywhere, because you reach a tipping point much faster when there are many voices in different places that have more influence than we know, for all the reasons that Melissa and Mary highlighted in the toolkit. So there's parallel tracks here for getting this message out to multiple audiences at the same time, so that by the time we get to policy consortium in November, we'll have some real progress made and some next steps action. But the first part is building that buzz that's measurable, so that people want to, the people that are influential want to do more.
I'm really glad that you asked that question, Cynthia, and Brittany, thank you for your comment in the chat. I think one way to look at this campaign is to really look at it through the lens of it being a virtual lobby. And you know, as Rebecca had mentioned earlier, and Melissa had mentioned earlier, we really want to make, this is sort of part 1, phase 1 of the lobby, the virtual lobby that we're doing. We want to let people know that there is an issue and there's a solution to that. And we want to get people on board. So, you know, thinking of, for example, like the gun lobby or something, right? So people identify an issue and then they collect different stories from across the country about, this is why, you know, I want control here because I'm nervous about going to school, whatever that may look like. And then translating it to this campaign with health needs navigation, sort of the same thing. We want to socialize this issue. We want people to understand why navigation services are important. And we want to reach, you know, all these different people with all these different experiences and within the healthcare space, and really get their perspective and their story to really strengthen the need, to really strengthen our ask, and that people understand, well, this is a legitimate need that we have. So just looking at it sort of through that lens may be helpful. So this is the education phase, the lobbying phase. And then we'll get into a lot more of the hardcore stuff as the months go on. And Mo, I believe you had your hand up, and then Betty took herself off mute, so we'll get to her after.
Can't have a meeting without me saying something, right? A few of us were on the state leads meeting, and we talked about having sort of like a quick guide on how to maybe pivot if these conversations become a little too political. Is that something that's available in this toolkit, or that maybe we could have access to?
It's the answer to that is no, not exactly for just that pivoting. But what I want to just ground the group in is making sure that you remember who needs navigation is helping. I think when you underscore that common denominator that Rebecca talks about, it really avoids that sort of political conversation that I think some of you are raising here. And so, you know, it's, in many ways, it helps everybody. It especially helps those who are traditionally, you know, living with limited resources. And I think that is just a sort of helpful frame to consider when, you know, thinking through, you know, how we talk about this. But I think, Mo, what you talked about is a helpful reminder, and we can certainly add that into the toolkit. So I just also wanted to add, our toolkit is a living, breathing document. So if you find that there is something missing in the toolkit and you're just like, you know what, well, we should have this, Mary and I can add it in. so don't be afraid to raise some of those points to us. And also know that, this is very much the first time we're doing this campaign. And so even though the ask is right now building that buzz in your community, know that in the future, we will certainly have more explicit or tangible either deliverables or asks that we want you to be sharing with others. And right now we're at that phase of just, knowing who your allies are, so that when the time comes to make those more specific asks, you know who to go to, who has your support. I hope that makes sense.
We'll definitely create some pivot points, Mo. That's a great point. And it's always that balance of, did we think of everything? Of course we didn't. We never will. That's why we have all of you to help us identify what else without over stacking, over anticipating, where we give you so much that nobody can do anything because there's just too much. Pivot points, great point, and we will create that.
Thank you.
You got it.
And Betty Ford, did you have something you wanted to mention? Okay, I guess not.
All right, well, I see we have about 2 minutes left. I will share the remainder of the presentation, because I think there are a couple fine points we need to make, right, Mary?
Yes.
Okay.
So in the chat, I shared the link to sign up for the campaign digest, which again is just once a week. There'll be updates on the campaign. So different actions you're able to take that week. You get to hear or see from other volunteers the actions that they're taking in their community or things that they have been doing weeks prior. Register for a patient congress. This year it's focused on health needs navigation and all the different elements that go along with that. So it'll be super interesting to have that ahead of our week of action. Sharing your health needs navigation story with us and using our examples sort of to help guide that narrative. And make sure that when you're posting on social media for the campaign, that use a hashtag health needs nav or the full health needs navigation. And of course, keeping in mind the week of action from October 11th to 15th. And these are some additional key dates here, just so you're able to sort of see it. And if you have any questions, we are happy to set up a call or email back and forth. So I will drop our direct emails as well in the chat.
And Melissa, you mentioned this, but the can we talk about cost of care is a pretty significant new resource that's rolling out. It's still in creative, but coming very soon, very polished, very helpful as a new area to help overcome the stigma, to help everybody see this is something that should be a habit, that you raise this in your clinical encounters with your loved ones, to talk about the concerns that you have, because we saw that data point. This is everybody who worries about it, no matter how well insured you are, no matter how well resourced you are. And I think that's, Tony K was asking about what resources do you have? That's sort of the superstar rock star one that's coming momentarily, if not sooner, just not in time for today's call. And there will be additions to this. The FAQ that we have is relevant for all of you, but other items that are coming as well. But that can we talk about cost of care is sort of a pivotal piece for y'all to take a look at, embrace, and think about how you can share that. That's one, Brittany, that can go to everybody in Florida and their mother and brother, for example. And there are more. So stay tuned. I believe they're coming soon, right, Melissa?
Yes, They
Yeah.
are. And I will also say, a couple of you had raised just, wanting to share this with legislators. We also have one for policy audience that we will also include as a resource that, that you can send that way as well, in addition to the Can We Talk. But our campaign digests will let you know that way when all of these materials are available. And if you need further guidance, you know where to find Mary and me. All right. Tony K, before I see your hand.
Yeah, I'm sorry. One last question on
Sure.
that. Can we talk about cost of care? Are there any like pharmaceutical companies? Are there any other logos besides PAF, NPAF that are on those print materials?
No.
Only reason, no.
It's just
Okay.
NPAF and PAF.
Just PAF and NPAF.
Perfect. Okay, because then sometimes you have medical centers that can't use it if you've got pharma or something like
No,
that.
there's no,
Perfect.
these were built by us for you.
Perfect. Thank you.
Get excited, everyone.
Right, yes, very exciting. Thank you all so much for taking the time to join us today. Mary, I don't know if you have final words.
Well, I'm going to drop in the chat just something that you're able to post on social media right now as we get off the call, just to sort of start off with some quick buzz generation and tweak it to your liking on your Facebook and Twitter. Hopefully that went to everyone. Yeah, you can copy and paste that, and it's also in the toolkit as well. So
Can I just say I'm very excited because I just beat COVID today. So I got my first negative test in like 9 days. And I'm very excited.
Goodness. Good. Thanks. Well, we're celebrating with you.
Thank
Yes,
you.
we want you to stay healthy, Brittany, for sure.
We call that a BAM.
Yes, thank you so much.
Bam.
I'm so happy. I get to go back to work. I've been so bored.
Oh, no kidding. Well, be well all. Thank you so much. Thank you, Mary and Melissa.
Thank you, Rebecca, for joining. And Jamie, I see your question. We will share the PowerPoint to this, so you have that as a resource.
Okay, thank you all. I had to jump off like 5 minutes ago, so I wanted to just kind of catch up.
No problem. All right.
We hope to see you all next week. Patient Congress.
Yes.
Oh, yes.
See you at Patient
Bye,
Congress,
everyone.
everyone. Bye.
Take
See you
care.
later.
All.
Thank you.
bye.
Bye-bye.